Telephone psychotherapy is becoming more common rather than face-to-face psychotherapy. And there was this article in the Journal of American Medical Association that was comparing them. So what did it turn out to be?
Well, I find it odd, first of all, that we even are doing things on a telephone now, and let alone that, how about email? I mean, things are getting so impersonal.
And Skype.
Yeah, and the whole idea about psychotherapy is to listen sacredly and to care. So you have to be present, and the presence of the personality that's doing the psychotherapy is really important. But strange as it may sound, telephone consultations are better than nothing. In fact, they showed in this particular study in JAMA that the difference was in the 6-month study of 325 patients who were depressed and had 18 sessions, is that fewer people discontinued therapy if they had telephone consultations rather than having to make the trip to the psychotherapy. So there was a convenience factor that made a difference.
Well, do you think that people would prefer to take a medication than to have psychotherapy?
No, I don't. Although a lot of people would rather do anything besides be depressed. And when you think of 10% of America having a significant depression, it's a big deal. I think that telephone consultations would be better than taking drugs, because the drugs never solve the underlying problem. They simply give you a little bit more of a better feeling. They give you that feel-good serotonin effect from the antidepressants themselves.
Well, the other thing is, too, I think that when people are depressed and they need to talk about it, sometimes it's hard for them to get off the couch or to get out of the chair or to go to the appointment, or many times people are just too busy to want to go to the
well, that or they make themselves too busy because they can't afford it, or they just don't want to get into the problems that are there. Some people can't afford the transportation or don't have any transportation. There are a lot of time restraints from people who are busy people that just don't want to get away from their work or their passion or whatever it is they're doing, so they'd rather do nothing or else just have it magically go away with a pill.
Well, what role do the insurance companies play in this, though? Because insurance companies, it seems to me, are more in favor of just giving the drug because it's cheaper than paying to go see a psychotherapist.
That's true. In fact, they pay more for a 15-minute visit relatively than they do for a 30-minute visit. So you'd think if they spent twice as much time, they make twice as much money, but that's not true. They make quite a bit less than twice as much. So they're encouraging that it's in and out, take the drug, and go home. But for this system that we have here, at least it gets more people there, but at 6 months, what it shows in terms of how effective this treatment is, that it's more effective if you have somebody that's there face-to-face. So I think the bottom line here is that one size doesn't fit all. It's not like there's one particular treatment that's fixed for all patients.
I also think it's kind of handy to be able to talk to your therapist on the telephone, say if something came up before your appointment and you needed to talk it through and talk about it, that might be a good time to do it.
Sure. So everybody's different, their needs are different, their situations are different. And the people who are giving the treatment, they are different too. So I think each case needs to be worked at individually to see what's best for the patient, see what insurances will do in terms of supporting it, and make sure that the therapist that you have is the right one for you.